Good morning, my name is Dana Gavino and my topic is lactic acidosis. First, we have the first video.
Great tips, and we're working our way through the ABCs of losing weight. Our entire audience is working out today. How's everyone feeling? Next up is L, and that stands for lactic acid. Lactic acid, it occurs when you're working out really hard. And what happens is if you enter into your anaerobic zone, you no longer have enough oxygen to create energy. So what happens is these little energy factories in your cells, mitochondria, burn carbohydrates. And when they do that without oxygen, the byproduct is lactic acid. And as you're seeing in the sponge here, lactic acid builds up in your muscles. So that's why you get that burn when you're working out hard. But here's the deal. Within an hour, that lactic acid is flushed out of your muscles. So it's not the lactic acid the next day that's making you sore. It's called delayed onset muscle soreness. That can last from 1 to 3 days after you have a hard workout. So what do you want to do? Those are often due to little muscle tears at the microscopic level. Massage is a great way to go. I love using a styrofoam roller, but if you don't have one, you can even use any balls that you have at home. You take a golf ball or a tennis ball, and if you have a particular area where you're sore, just knead out those muscles. It's self-massage. It's free. It's very effective. Golf ball, tennis ball, football, whatever you need.
You touched on it a little bit, but understanding muscles is key in weight loss, and that's why M is for muscles. Your muscle is made up of multiple fibers. Now, what happens when you're doing a vigorous workout, you're actually tearing, you're getting microscopic tears in your muscle. And what happens is your smaller muscle, let's say this is your thigh muscles here, going through that period of repeated tearing and recovery, provided that you're eating the right stuff, is going to lead to this larger muscle mass. More Twizzlers for you.
Yeah, good job.
All right, so we picked 2 volunteers from the audience.
Now we have the definition. Lactic acidosis is when lactic acid builds up in the bloodstream faster than it can be removed. Lactic acid is produced when oxygen levels in the body drop. Causes. The most common cause of lactic acidosis is intense exercise. However, it can also be caused by certain diseases such as AIDS, cancer, kidney failure, respiratory failure, and sepsis. A common medicine used to treat diabetes, called metformin, can also cause lactic acidosis. If you take this medicine, have your electrolyte levels checked 1 and 2 weeks after starting it. The principal symptoms are nausea and weakness. Now we have another video.
Hi, Dr. Goldberg here, continuing our internal medicine series of lectures. Today we're going to talk about lactic acid and lactic acidosis. Some confusion out there about this test. We're most commonly using it at the hospital for monitoring our septic shock patients, but I think we should talk a little more about it. So normal levels of serum lactate are between 2 and 2.5. High levels are more than 4, certainly. So lactate is produced in most tissues, with muscle being the main source in the body. It's produced under anaerobic conditions and gluconeogenesis. Under normal conditions, lactate is typically cleared by the liver and a small amount by the kidneys. So when the serum lactate level is elevated, there's 2 types. There's type A and type B. Type A is due to states of tissue hypoxia or hypoperfusion. So we're going to see this in shock, especially septic shock, cardiogenic shock, hemorrhagic shock, any place where there's regional ischemia, compartment syndrome, gangrene, Fournier's gangrene. Elevated levels are certainly associated with mortality. On the other hand, type B type of lactic acidosis is due to about 12 different things. I just want to review those with you so you're aware that many types of medical problems can cause lactic acidosis. Number one, seizures can cause transient elevations. Number two, excessive muscle use. So people who are marathon runners, people who are having asthmatic exacerbations and increasing their work of breathing, that certainly can be associated with lactic acidosis. Pancreatitis, subacute bacterial peritonitis, burns, smoke inhalation due to cyanide or carbon monoxide inhalation, diabetic ketoacidosis, obviously, thiamine deficiency due to poor nutrition, especially found in alcoholics, hyperemesis gravidarum in our pregnant females, or anorexia nervosis, or even in patients with gastric bypass surgery. Certain cancers can cause lactic acidosis, especially lymphomas or leukemias, if there's mets to the liver. Finally, never forget about drugs. So certain drugs are associated with lactic acidosis. These include metformin, acetaminophen, linezolid or Zyvox, beta-2 agonists, and epinephrine, likely due to beta-2 stimulation. Cocaine, theophylline, propofol, and certain meds used for HIV infection. So, large potpourri of causes of lactic acidosis, but I think it's important to kind of know the differential diagnosis of that. Thanks a lot, Dr. Goldberg signing.
Now we continue. Pros. It has treatment. The main treatment for lactic acidosis is to correct the medical problem that causes the condition. The cons. The condition is often suspected on the history and examination, for example, shock, heart failure, and is easily confirmed and quantified by measuring the blood lactate level. A particular problem is the diagnosis of the condition when present as part of a mixed acid-base disorder. It may be associated with other causes of a high anion gap acidosis, for example, ketoacidosis, uramic acidosis, and not be suspected. Another video.
In this tutorial, we'll talk about how lactic acid is produced and under what conditions large quantities of lactic acid are made in the body, resulting in lactic acidosis. I'm assuming that you're familiar with glycolysis, with the TCA or Krebs cycle, and the respiratory chain, and we'll only discuss those as they relate to lactic acid production. So what you can see so far on the screen is a simplified version of glycolysis, where one molecule of 6-carbon glucose is converted to 2 molecules of the 3-carbon pyruvate. There's a net production of 2 ATP in this pathway and reduction of NAD to NADH. And of course, when we say reduction, we're talking about the chemical reduction of transfer of electrons and hydrogens away from carbons in glucose to NAD to make NADH. And you can see that pyruvate, the carbons in pyruvate, are more oxidized than those in glucose. So the production of these NADH and the requirement that they somehow get reoxidized to NAD+ is at the heart of lactic acid production. And we'll get back to that in just a few moments. Okay, so let's look first at what happens under conditions where not much lactic acid is released from cells, but instead the pyruvate enter the mitochondria and full carbon oxidation occurs. So these are under conditions where there is plenty of molecular oxygen and fully functioning mitochondria. Pyruvate, under these conditions, enters through the pyruvate transporter, is oxidatively decarboxylated by this amazing enzyme, pyruvate dehydrogenase, which is highly regulated, and 1 carbon dioxide comes off of each pyruvate, and an acetyl-CoA is the result from each pyruvate. So the 2 carbons on an acetyl-CoA combine with a 4-carbon molecule in the TCA cycle to make 6-carbon citrate, 2 CO2 are produced in the pathway and released, and there's 4 steps of carbon oxidation. In those carbon oxidation steps, electrons are transferred to 3 molecules of NAD and a molecule of FAD, resulting in 3 NADH and 1 FADH2 produced. These cofactors are reoxidized in the respiratory chain. The NADH at complex 1 of the respiratory chain. The FADH2 is reoxidized at complex 2. And in the process, the electrons from these oxidations are transported down the electron transport chain to the various complexes and ultimately to molecular oxygen. Most of the oxygen we breathe is used right here in complex 4, and the oxygen is reduced to water. Okay? And during this process, you'll recall that protons are pumped through these protein complexes, increasing the proton gradient here, and it's the energy of the proton gradient that drives ATP synthase to create ATP. So this, of course, is a summary of what happens when glucose is fully oxidized through mitochondrial respiration. And if you recall, I started out by saying that it's very important how this NADH gets reoxidized. The NADH, though, is formed in the cytoplasm from glycolysis, how it gets reoxidized to NAD+. So let's look at that next. Please turn to the next slide. So under conditions where there's plenty of oxygen, mitochondria are healthy, most of these NADH that were produced out in the cytosol are reoxidized back to NAD+ by transferring their electrons through some electron shuttles. There's various shuttling systems in mitochondria. We're not going to get into the details. It's not really essential here. But suffice it to say that those electrons are transferred into the mitochondrial matrix to NAD or FAD, reducing those cofactors to NADH or FADH2, which can then be reoxidized in the respiratory chain. Okay, and the result is that regeneration of NAD+ out in the cytosol, which can be used for more rounds of glycolysis. Please turn to the next slide to continue. So what happens when there's insufficient respiratory chain activity? If either the oxygen concentration is low, or in cells like red blood cells that have no mitochondria, or something that inhibits the respiratory chain activity. Okay, what happens under those conditions? Well, the NADH in the mitochondria build up, levels of NADH build up. The NADH cannot be fully reoxidized at complex 1 if there's not enough oxygen to be the final electron acceptor, or if for whatever reason, we'll talk about some of these in a moment, the respiratory chain itself is inhibited. Okay, so when NADH builds up, the TCA cycle is inhibited. So we have a decrease in activity of the TCA cycle. Pyruvate dehydrogenase, this enzyme, involved in producing the acetyl-CoA, is also inhibited by elevated NADH levels, so its activity drops. Pyruvate remains out in the cytosol. The NADH that was produced from glycolysis in the cytosol will be unable to transfer its electrons into the mitochondrial matrix because, of course, under these conditions, the NAD+ levels in the matrix are low and NADH has already built up. So this process of the electron shuttling will be greatly inhibited. On the next slide, we'll see what does happen with the cytosolic NADH. In the absence of sufficient respiratory capacity, the cytosolic enzyme lactate dehydrogenase comes to the rescue by using the transiently elevated cytosolic NADH and the pyruvate that was formed from glycolysis, and transferring the electrons and the hydrogens from the NADH to the pyruvate to regenerate the cytosolic NAD+, which is required for glycolysis to continue, and resulting in lactate production. Okay, so what happens with this lactate? Well, it is shuttled out of cells. When it starts building up in cells, it is shuttled out of cells through a transporter, so we'll draw a transporter here, along with a proton. So the result is that there's an increase in acid, we'll call it lactic acid, that is released outside of cells.